Hi, good afternoon, everyone. Glenda, could you please turn on your video? Okay, you've done that. Great. Um, Good afternoon, everyone, and welcome to the COVID-19 Academy again. The COVID-19 Academy is a joint collaboration of UNICEF India, WHO India, HCL Foundation, and Sphere India, aimed towards the capacity building of volunteers and outreach workers from across India on different aspects of COVID-19 preparedness and response. Towards this, we welcome you to our 54th session on panel discussion, actually, on continuum of care for COVID-19. In this session, we will understand the continuum of care for those who are suspected to have COVID-19, are contacts of COVID-19 positive persons, and who are suffering from COVID-19 in communities and in healthcare centers. For this today, we have with us Dr. BEENA E. Thomas from the National Institute for Research in Tuberculosis, Chennai, Dr. Ramnath Subaraman from Tufts Medical Center, Boston, USA, Dr. Ravikant Singh from Doctors for You, Mr. Edwin Koshi from Chennai, and our moderator for today will be Dr. Vivek Virendra Singh from UNICEF India. I'll take a brief moment to introduce all our panelists. Dr. BEENA is a social scientist who has had over 3 decades of experience in social and behavioral research in TB and HIV. She served as Deputy Director heading the Department of Social and Behavioral Research at the National Institute of Research in Tuberculosis, formerly the Tuberculosis Research Center in Chennai. Currently, she serves as a consultant for social and behavioral research in the same institute. Dr. Ramnath Subaraman, MD, MSc, FACP, is a practicing infectious diseases physician at Tufts Medical Center in Boston, USA. He's also an assistant professor in the Department of Public Health and Community Medicine at the Tufts University School of Medicine. He conducts research on health services for individuals living with tuberculosis in India. Dr. Ravikant Singh is a public health professional with specialization in emergency preparedness and response. He founded Doctors for You in 2007, which is now a leading medical humanitarian organization of India. His organization is currently working in 18 states across India and in Nepal, Bangladesh, USA. DFI has responded to more than 26 major emergencies in India since 2008 and currently is involved in COVID-19 response in more than 12 states. We also have with us a very special invitee today, Mr. Edwin Koshi. He's a senior sales engineer at Johnson's Control in Chennai. He was tested positive for COVID-19 on May 19th, and he was in home quarantine for 2 weeks. His second test was done on June 1st, and it was negative. He's here also to share his experiences. Last, I would like to introduce Dr. Vivek Virendra Singh, who has 20 years of global experience working with public health department, academia, WHO for polio eradication and with UNICEF. He has worked in public health emergencies and strengthening early warning and response systems globally. Editor of a book, Transforming Public Health Surveillance, and co-teaches a course by the same topic as an adjunct faculty at Emory University. Welcome all of you. I am now going to hand over to Dr. Vivek, who is our moderator for today. Thank you.
Thank you, Valerie, and good afternoon, good evening, wherever you are to everyone. And thanks a lot for the COVID Academy team for putting together this very relevant and timely session. And I'm very happy to hear about the panelists, the eminent panel that we have today. So moving on, with this session today, if you would have seen the topic of the session, that's continuum of care from communities to care centers. So for all our civil society members and others who have joined, you would realize that when we began the academy, we were at a stage in India where there were very few cases, mostly related to travel. And now with the widespread outbreak and also the lockdown easing up, where we are definitely going to see more number of cases. As you see every day, the number of cases rising. is to an extent that we certainly now know of someone um, in our social circle who is affected by COVID. So this session, what we'll try and do is through our eminent panel, is give you pointers of how to mitigate this epidemic, especially in India, that is to reduce the morbidity and mortality, and more so in trying to understand that with the increased number of cases, what are some of the nuances of managing them, both in communities as well as the healthcare centers. So with this, what I would want to do is very happy to have Edwin with us, who has agreed to share his experiences of what went through, what he went through when he was tested positive. So Edwin, if you can hear me, let me open the panel by asking you a very simple question that we would just like to hear from you, your experience of going through this, that when you were tested positive and now that you are tested negative, thankfully you are cured. So what was your experience like?
Yeah. So thank you so much for giving me an opportunity to be a part of this program and for giving me a chance to share my experience. I was tested positive on May 19th, and I got the symptoms 5 days prior to it, which started with fever and headache, which went on for like 2.5, 3 days. So once I got rid of fever, I lost my sense of taste, smell, and appetite, which went on for like 2.5 days. And that's when on the third day I get tested on May 18th, and I get the result on May 19th saying it's positive. So obviously, when hearing all the news across the globe, what is happening with all this COVID-19 issues, I was a bit upset and scared, as in, when I got to know that I've been tested positive for COVID-19. Fortunately and thankfully, my family gave me all the support, including Dr. BEENA, gave me all the support and all the strength and gave me good advices to cope with the situation and make me go forward in a good way. Talking about the experiences of this, I would say that, this has indeed been a different experience for me with the 14 or 15 days of quarantine and the phases of life, what you go through. You think about that, you think about a lot of things. So I live with my wife and my daughter. My daughter is only 1 year and 2 months old. So I kept myself isolated in the room for 14 to 15 days because this room is with an attached toilet. So I was always in the room. I did not step out from this room for 14 to 15 days. And because even though I carry the virus in my body, I had to make sure that I don't transmit or spread this to another person at home, because that's when, all the dangerous things happen at home, in your family. And, I took rest, had a lot of foods, drank a lot of hot water, ate a lot of good food, had a lot of fruit juices, had hot water with honey and turmeric powder, all this right from, everything what was advised by the doctors. Indeed, I took an advice from Dr. Ramnath, who's present over here. He could actually advise me well, and I took his advice in a good way and kept on to what he told me, go forward. So, and on the 14th day, when I went for my second test, that's on June 1st, I was tested negative. And that's when I felt that, you can actually, we have to be mentally pretty strong to get rid of all this. Only if you feel that, you can get going and, you feel that, you have to, this will get away from you, only then things will happen in the right sync. So actually, I feel, yeah, this is what I can share with you. Thank you.
Thank you, Edwin. And this gives us good pointers for move ahead in this discussion. And I'll pick up on one of the things that you said, that you were isolated at home. And this is what we are going to increasingly see. If we all remember who are working in COVID response, that initially even asymptomatic patients were housed in healthcare centers or even hospitals. And gradually, as the number of cases increase, so this is going to be the new reality, that milder cases and other cases might be at home and being managed. So my next question is to Dr. Ramnathan. And if you can hear me, that this is a very important point that, as Edwin said, that he was trying to follow advice from the physicians that how he should manage this at home. So what do you think that COVID-19 people who get affected by it, how should they be prepared for home isolation? And what's your advice for the Indian context, especially as we will see more of this? And how should the families manage those in isolation and also themselves?
So thank you again for inviting me. So I would say one of the challenges with home isolation is that it really depends on one's home circumstances. So if you take Mr. Edwin's case, he was in a position where he had a separate room, separate bathroom, such that isolation from the family was possible. And that's very critical. What we know from studies in China and what we also have seen in the US is 75% of transmission happens within the family. Of course, because they're your immediate contacts. And so reducing transmission in the family becomes very important to controlling the overall epidemic. But it's a very challenging issue for those who don't have the additional space to, for example, self-isolate in a room and have a situation where you are separate from other family members and can manage to do that safely for 14 days. So that's a central challenge. And in the Indian context, for people who don't have such circumstances, now you think about people who live in single rooms, in maybe 1 to 2 rooms, maybe they don't have separate doors separating rooms, or in certain circumstances in urban India, they're living in slum settlements where there may be several people in an individual room. That's where figuring out strategies, isolating individuals who are infected, who are in such circumstances in safe quarantine facilities may help prevent family transmission. But as the epidemic increases, that may or may not be possible. In the US at the beginning of the epidemic, for example, most people were told to stay home, and there was quite a lot of family transmission. In terms of the health of the individual at home, there are, I think, 2 items that are important. One is hydration. With any infectious disease, when you're having ongoing fevers for days, it's very easy to have a lot of fluid losses, even unrecognized, from fever, from sweating, from poor oral intake, such that people become dehydrated. That's extremely common. And oftentimes that's the first thing that tips off people to getting admitted to the hospital. The second point about safe home isolation is that oftentimes the food and diet change completely when someone is sick, or they say you should only be eating curd rice or things like that. I think an important point is the full range of diet should be offered to the individual. The diet itself shouldn't change. It should be healthy. It should have sufficient protein. But really reducing the diversity and the quality of diet is often counterproductive in such situations. People may not feel the urge to eat, but actually when you're sick, you have greater nutritional requirements. So you should be eating the same or potentially a little more if possible. So those are the third point about safe home isolation, is to be able to recognize the warning signs of when you should be seeking medical care. And this is particularly tricky with COVID because we see many situations where shortness of breath occurs very suddenly, well before, and people may have reduced oxygenation in the body well before they recognize the shortness of breath. So shortness of breath with any even mild physical activity should be an early warning sign, because oftentimes when you're sitting in bed and you're not doing any physical activity, you don't realize that you have shortness of breath. So even if you have shortness of breath with any physical activity, that should be a sign to get into the hospital quickly, because people can decompensate quickly from COVID, especially the inflammation of the lungs that we see with COVID, especially when there's delay in recognizing that there's low oxygenation and shortness of breath.
Well, those are very important points, and especially how to prepare the patients. And as you said, for high dense settings, if we will have to have differential strategies instead of the same strategies, as you said, that people who are lucky to have even a separate room where they can isolate within the families. Let me pose a question to Dr. BEENA, because incidentally, I have been traveling for the past 1 week, taking flights for some personal reason in India. But what we see is when March, we had the number of cases which were far less as we compare today, but there was more fear for the disease itself. But now we see people moving out after the lockdown as it is being relaxed. Maybe they might have less risk perception about the disease. So I would want to ask Dr. Beena how different people perceive uh, the COVID-19 and what is going to be an important message moving forward for the new normal? Because we know the risk for the disease is not decreased, in fact, has increased with more number of cases around us. So, what's your take on how different people perceive COVID-19 and what should be the message now? Dr. Beena, if you can hear me.
Yes, Vivek, thank you so much. That's an excellent question. It's so true that when it started, there was the real panic in the pandemic. Everybody was, up in arms, wondering what the uncertainty. And then you have the lockdown and you have many other related problems which seem to be much more difficult to handle than COVID itself. For one thing is the uncertainty. And it's interesting, the question that you asked, because, one of the things that as a social behavioral researcher, trying to understand why is it so difficult for people to screen, why is it difficult for people to disclose their symptoms, is also one is the lack of awareness, two is their perception of risk. And like you rightly said, who do they perceive, are at risk? We find that the media has had an infodemic. You have so many different kind of, perceptions about the illness that now it is either linked to a cluster. First, it was very sad. It was the Tabligis and it went on. Then it became the Coimbatore cluster. Then it became those who have a travel history, those who have comorbid conditions. So people are, so confused as to, am I at risk? And now with COVID spreading, it seems like people are just getting desensitized. The other day, I was talking to one of our, maids in the neighborhood who came from one of our tenements, and she said, is there really corona? Is there really corona? And I was quite surprised. Why do you ask? Because she says, we don't understand what's happening. We don't know what happens when that virus goes inside. All we know is this is the first time that they say it's a flu. You're just whisked away to hospital, you're isolated, and then they're brought back. You don't know what's happening inside there. So is there really corona? So, and then there's this whole concept of this, the information on the biological warfare. And imagine going down to different levels saying it's something that I believe it's to wipe off the planet. So how do we perceive ourselves at risk? Everyone's going to be wiped off. So it's high time we start working and start getting back to normal. So I think, like you said, people have become a little desensitized now. And considering that, now in India, you find more than 80-90%, are getting back to normalcy, even if they're diagnosed positive. You see Edwin there looking hale and hearty. People have really stopped fearing the illness. Yeah, I'll stop there.
Those are very important pointers. And that we need to make sure that in our risk communication moving forward at this stage, we need to make sure that people understand the risk at least judiciously and do not stop taking precautions which are so necessary. With this, let me now come to my next panelist, Dr. Ravikant, who runs an NGO, which is, and of late, I also saw his NGO doing some remarkable work in the high dense settings in Mumbai. So my question to Dr. Ravikant is, what roles do NGOs actually not just do, what are they playing and what can they play at this stage of mitigation where, we would see more number of cases, and as Edwin, we will see more and more number of cases who will have to be managed at home and in communities. So what roles are NGOs like yours playing and can play?
Thanks, Vivek. So I'm taking a clue from Dr. Ramnath and BEENA ma'am, what she said. So that here we have to understand two things. that almost 80% of the transmission of this COVID is happening inside the house or during the public transportation. And the second thing with Madam said that now means everybody is thinking that we have won the war against Corona, so there is no need to wear the mask. And the situation is very, if you see Mumbai, almost all the wards with high density slum is showing more than 2,000 cases every ward in Mumbai. So it's very, very important now to educate the public about the importance of wearing a mask, using hand sanitation and the social distancing norm. So what exactly NGOs can do, and I see it's a big role coming up for NGO. Till now also lots of NGOs are working across India, but in future I'll see much more required, because if you see in Mumbai, initially Mumbai police was handling everything. Then they were totally tied up. More than 30 police officers died while on field. And now CISF and other paramilitary forces are helping the government. But situation is so dire in Mumbai that in fact we are not able to scale up our isolation facilities because there is a huge shortage of manpower to run those facilities and do community level screening and tracing work. So, so here a few things which I would suggest to all the NGOs, CSOs who are working in high density area or district is the awareness campaign about this use of. As you know, yesterday WHO has changed the guideline on the use of masks. Now every person above 60 year and above has to wear preferably medical mask. The second important thing is if you are using cloth mask, then it should be 3 layer. So the innermost layer should be of cotton or some absorbent material. The second layer is of polypropylene. So polypropylene, if you see that once when we have banned the plastic, we use one the cloth type material bag. So that is basically polypropylene bag. So the middle layer should be of polypropylene and the outermost layer should be of any polyester material so that it can resist water. So like production of these masks is one very important thing. Then distribution. We are also doing the hygiene kit distribution where we keep few like 5 set of masks, 3-4 soap, and if possible sanitizer also. Otherwise mask and soap is perfectly fine. So door-to-door distribution of this material is very important. Then NGOs can help the municipality or the local authority in screening and contact tracing, because that is the one area. So for every one positive patient, we have to screen or at least 15 to 16 patient minimum. So the load is very high. So, and as you know, this screening is very simple, like this infrared thermometer, and now we are using this pulse oximeter also for, and these two can be used by any literate person. The only thing I want to highlight here, because there are so many NGOs that we have to use this gun like we have to keep it just 3 to 5 centimeter away from the forehead, not like 1 feet or 2 feet, because if you see many picture they use it very far. And then this pulse oximeter, this is very good equipment for the screening as well as for the patient who are asymptomatic or mildly symptomatic and are in home isolation or home quarantine. So to monitor, this is very important. So these
Fair
are
enough.
the thing which NGOs can play.
So I think this is a very important point that NGOs, as Dr. Ramnath had also said, that let's say if people are at home and we need to tell them what should be the trigger that they should be seeking care. So in low socioeconomic areas, people in high density areas, with those kind of situation? Because I remember Edwin, I was speaking to Edwin, he had mentioned that he at least had an instrument to measure the oxygen saturation, which is a luxury for many. So NGOs can play roles even there, screening and making provisions for all these supplies. So let me move to one area which I thought is very important and should be discussed. And my question goes to Edwin, is that I see, as you had mentioned, that although God willing, thankfully, it was not a severe disease with you, but as you rightly said that, it takes you into a flashback about the whole life and as if you have been struck by something really bad. So in your opinion, how do people who get diagnosed positive need to be prepared, especially to cope with this psychosocial side of the disease, and especially after the diagnosis and while you are going through this? Edwin, can you hear me?
Yeah, I can hear you. I can hear you, doctor. So
Sure.
basically, it depends, after you get diagnosed positive with COVID-19, it depends on, what the doctors advise you, because it depends on whether you have to get admitted in the hospital or you have to be in home quarantine. So it depends basically on that. So, you see a lot of, especially when you're tested positive for this, you see a lot of stigma and things happening, if you live in a house over here in Chennai, what they do is, if you're tested, if one of the people living in this the building is tested positive, these people, the corporation people, they paste a banner on your gate saying, this is an infected area, so no one should enter or no one should come out of this place. So that's like kind of a disgrace what is happening to so many people staying in the building. And secondly, coping with the situation is that, you have to be mentally strong to cope with the situation. You have to be very positive, thinking that, you will get through this. Because as I told you a couple of minutes back, when I heard my case, I was mentally so down. But people gave me the courage to go forward and be strong and fight it out. So and coping, yeah, I think, am I good? Am I good? Am I good with the information what I gave?
No, fair enough. I mean, I see two very important things, and which I would want to take to Dr. BEENA, that as you said, the identification that somebody is infected by the disease, and then if that area is marked for containment, so this can also, and as we have seen, can lead to stigma if the risk communication is not proper in that area. So my question to Dr. BEENA is that do you think stigma is really a challenge for this epidemic response? And if so, why? And what do you think is needed for those isolated or infected or affected by the disease and their families vis-a-vis the stigma issue, Dr. BEENA?
I definitely feel stigma is it's a huge challenge, and I think stigma has just been created for COVID. Like Edwin rightly said, can you imagine the first thing it was for quarantine, they would have a sticker. And I was involved in a psychosocial counseling unit with the corporation. And one of the major, responses that came from the people is, they've just stuck the sticker, and it's so demeaning, because nobody would come and, come to our place. Now forget, you're not waiting for visitors or guests to come, but basic services, the gas man would leave the gas and run away. And there's this elderly couple who said, we couldn't even carry that cylinder inside, So what do we do? And there's a kind of loneliness that grips you. And, people just going past your house, like what Edwin said, is just, turning back to see, oh my God, there's a sticker in that house. So almost treating people like, they are, it's like they're untouchable. Nobody should go near there. Everyone knows that you need to be careful. You need to treat everyone. Universal precautions have to be maintained. But what is the value add for this kind of big posters, or like what happened in West Bengal? You have, there in a part of the palm that is sealed, to track them. What have we come to? And also this word social distancing, super spreaders. I mean, what sort of terminologies are we using? People really have started, being inhumane. And you hear that we've had floods, we've had problems where there was this bond between humanity. But COVID, while it kind of equalizing class and caste and regions and countries and is just international, one thing it has resulted in using this term which I dislike the most, and that is social distancing, where people have really distanced themselves. Nobody wants to bother about the other person. It is physical distancing, but with that social support. That is something we advocate for all illnesses. And super spreaders, what sort of terminologies are we using? I think we need to be careful. Yes, there is a lot of stigma with COVID, which is not necessary at all.
I totally agree on this count, and especially discussing with some of the colleagues that if somehow we, as an epidemiologic inquiry, we are able to study that the delay in seeking care, which is caused by this whole stigmatization issue, how much of the epidemic spread was directly related to stigma. And I think there will be a lot of attributable proportion to it. I totally agree. And this is one area where I believe all of us should be working. The administration, the businesses, civil society, development partners, everybody who's engaged in this response should be working on this issue. And as you rightly said, that like in other emergency situations, we should be showing solidarity instead of the stigma issue. And now with increasing number of cases, God forbid, but it's very likely that we will definitely know somebody in our circle who will be affected. So that's all the more an important reason that we should be empathetic and we should be taking care of each other and not the stigma issue, as you rightly pointed out. But with this, another important point which comes to my mind is that with all the family members, so we have discussed about the individuals who get affected. So my question is to Dr. Ramanathan that so let's say if there is a family member who's affected, and we know that the family can have others who are at risk, let's say elderly, kids. So once somebody is, let's say, tested positive and isolated at home or otherwise, then who all in the family, as you said, 75% of the transmission can happen through the direct contact, especially in family. Then who all should be tested, and based on the understood natural history till now, when should they be tested, and how long has the quarantine been? So what's the experience from the US, and what's your take on this?
So there are 2 points that I should make. First, it's very dependent on how much testing you have available, one, and second, whether it's safe to get tested. At the beginning of the US epidemic, the US was very behind in testing. And we were only really testing critically ill patients in our hospitals at the very beginning of the epidemic. But this was largely a function of the fact that we didn't have enough tests to test broadly. And as the epidemic has developed, we've created a larger number of safe testing centers. People can come in their car, they can sort of drive through and get tested. There are very safe procedures and protocols at hospitals. So you need, one, sufficient tests, and two, safe procedures for the healthcare workers such that they're protected, but also the patient. Then the question is, what is the benefit of broad testing? So what we know from many settings is that somewhere around 1/3 of people have no symptoms whatsoever. And many individuals have very mild symptoms, such that they may not even, the thought that they're very sick from COVID may not cross their mind. And so one of the fundamental challenges with this epidemic has been that asymptomatic spread has been the major challenge that has led this to continue to propagate. So for example, the temperature checks. Temperature checks came out of the SARS epidemic when most people with SARS were symptomatic. You could actually screen people out with fever. It is still of some value with this epidemic, but really that's an extremely late sign. And by the time you're detecting a fever, the chances are they may have transmitted already, and there are probably several others who may have asymptomatic infection by that point. And so once one individual is identified in the family, if you are in a place where there is sufficient testing, getting testing for one, asymptomatic contacts outside the home, that is people without symptoms who you may have been in contact with, is hugely beneficial because you'll identify people outside of your family's circle who may have infection, right? And that allows them to be quarantined and rapidly prevent infection. The second is within your home, there's still benefit to testing individuals within your home. One is segregation of individuals within the home, as in Mr. Edwin's case. If there had been other family members who had tested positive, that may have changed the dynamic within his household. The second is, especially for older individuals, but any individual who may be at risk of complications, they know to monitor for complications. And the third is it reinforces the importance of quarantining for that given time period, which is a defined time period, but it reinforces that point. So testing of asymptomatic individuals, people who do not have symptoms, even within the family, I think is very important, but it's dependent on having enough tests available to do so.
Yeah, those are very fair points. And so let me ask again one important point which you mentioned. What has been your experience and what's your advice for the people who are at greater risk with their comorbid conditions? So what are some of those conditions based on your experience, and how to manage those contacts?
So certainly if there's someone who is older, and the mortality increases fairly progressively with age, particularly above age 55, 60. And for people who have other comorbid conditions, hypertension, existing cardiovascular disease, obesity, these are problems that, most of the deaths we saw were in the elderly. We have seen people who've been infected in their 40s and who've had major complications and died also. So it doesn't mean that younger people aren't affected. So for older individuals in the family, the first thing is masking is terribly important, as Dr. Ravikant was saying. Universal masking is something that has helped in our hospitals because we realize there's a lot of transmission among healthcare workers. So we have moved to a policy of using masks all the time. And now in many of our states, universal masking has been pushed by the government so that whenever anyone is going out there wearing a mask. It takes away stigma from those who are wearing masks by making it universal. So in some ways, it's a way of taking away stigma if everyone is wearing a mask. It doesn't make it seem like, oh, that person's wearing a mask, they must be sick. So masking of older individuals when they go out, it's something that can be used within the household, though it's much more challenging. But getting them tested early so that they can be monitored, so that they can sort of be safely quarantined even within the household from others who are sick is also very important.
Thank you very much. I think those are very important points. Let me take one of the things which you mentioned to Ravikant. I see a lot of actions where with the already overwhelmed health system that can be taken by the civil society. And especially these challenges are exaggerated quite naturally in high dense settings. We see almost 80% of the cases are in the major urban areas, and especially the slums in these urban areas. So what role are NGOs specifically playing or can play, let's say in Dharavi in Mumbai or the slums in Kolkata, where we saw also the cyclone recently? Dr. Ravikant, if you can hear me?
Yes. So this is very, very important question. And what is our experience from M Eastward is that all these isolation facility, if you see the number of staff, especially involved in hygiene, sanitation, is very less. And this is not something very technical work. So NGO can pitch in here and can do a great work. So like in Mumbai, we are training our the like cleaner sweeper as a hygiene technician, and we are deploying them in isolation center to do the all maintenance work, plus the food, like serving food to the patient. Then similarly, NGO can also, most of the doctors, volunteers are working day and night in this isolation center, and they are facing huge shortage of food. So providing cooked meal to these patient as well as the particularly health worker, doctor, nurses, is a great support which NGO can play. The third important thing is referral. So referral from home to hospital, or from like milder center if the patient develops some serious complication, to the medical college or higher setup. You need ambulance. So there is a huge shortage of ambulance. Agar ambulance hai, then driver nahi hai. So all these things are taking too much time for all those doctor and administrator who are involved in actual medical care. So all these tasks can be shifted to these NGOs who can very well manage these food chain, logistic, hygiene, sanitation, and ambulancing. And another big area where I think NGO can put, like suppose 6 years down the line, we have like wonderful vaccine for corona. Then you can imagine the vaccine, because corona vaccine we have to give everyone irrespective of the age, and starting with the elderly and high risk group first. So the number will be huge. So probably NGOs can pitch in that time also. And the other very important thing is like pregnant women are also getting COVID positive. Similarly, tuberculosis patient, most of the, we have, in fact, initially government was like the doctor, they were keeping TB with COVID patient in the normal ward, COVID isolation center also. So we advocated, and now we have separate ward for the COVID with tuberculosis patient. Similarly, pregnant women, they need more food, or children inside the isolation center. They need food more frequently. So NGO can pitch in. Similarly, lots of other psychological counseling and support is very, very important. In fact, in the first month of this disaster only, Dr. Randeep Guleria, AIMS Director, Delhi, he said that the managing these probably asymptomatic or mildly symptomatic patient is very difficult, because they are saying कि मेरे को क्यों रखा है, कुछ तो problem है नहीं, let me go home. So counseling those patients is very important. So NGO can provide these expert counselor to handle this. So these
Sure.
are big bulk which NGOs can handle.
For sure. And now more of these cases we'll see in communities. So that's where NGOs can play a greater role. And thank you, Dr. Ravikant, for doctors, for you all the work that you do through the agency. We also see some of your donations recently to AIMS New Delhi on the PPE kits. And this is just a representation for the entire civil society, but the civil society has played a great role. And one of the important points that you made is ensuring service continuity for otherwise the essential life-saving services. And for example, pregnant women, where should they get care, and people who have other comorbid conditions who need routine and regular care for their survival. So this is an important area, and I think this is a very important point for all CSOs, that they can help assure continued services for the other conditions. Let me now ask Edwin one important question, that how did your family cope with it? And do you think that some investment also needs to be done with the family members if somebody gets affected in the family? Edwin, can you hear me?
Yeah, I can hear you, doctor. I can. So families, can you please repeat your question, doctor? I didn't, can you please repeat your question?
Yeah, my apologies. I was very brief and direct. So I just want to ask your experience. How did your family cope with this fact that you were affected? And so do you think that families also need some kind of support? So if you can narrate, how was your family coping with it, and what was their reaction when they learned that you had COVID?
Yeah. All right. Thank you. Yeah. So as I told you, I live with my wife and daughter. My parents live in Kerala, and I've got my siblings who live in Kerala and Bangalore. So my wife was pretty strong. She was strong to accept this, and she told me that it's come to you. So let's face it. Let's fight it over. Pray to God. and let's get rid of this as soon as possible. And my mom, my siblings also were strong enough to understand that anyways I got infected. Somehow we never know, because it is not our mistake. It's come to our body. This virus has entered our body. So they were strong to manage and face things, and they were sure that I would recover from this very soon. They were strong enough to take this in a good way.
Okay. I have a question for Dr. BEENA based on what you said. But before that, I want to ask you for your message to anybody who got unwilling, if he or she gets infected with COVID and becomes COVID positive. So what's your message for the public at large?
I mean,
somebody who gets affected with COVID and is diagnosed as COVID positive. So what would be your message that now that you've gone through it?
Yeah, it's not easy to understand, or it's not easy to say that be positive and be mentally strong to get rid of this. But it's always good to be positive, be more prayerful, and believe that you can get rid of this ASAP. Secondly, stay hydrated, drink a lot of hot water, have a lot of vitamins, eat a lot of fruits, eat a lot of food. And the most important thing is that if you feel that, if you're home quarantine, if you've been advised by the doctors to be on home quarantine, make sure that you don't spread this to another person at home or in your family. That's when, the biggest problems happen, because as you rightly told some time back, 75, as Dr. Ramnath told some time back, 75% of the transmission happens with contact. So we got to be really careful with that and be positive and just believe that this will come and this will go. That's it. Thank you.
That's a very important message. And I would want to reiterate that it should not just, as you said, this is not going to be an easy feeling, but being positive, trying to be positive, taking support from family, but also making sure that you are fully conscious that you need to take care of others as well while you're infected, that you don't infect others. And I'm stealing this from someone else. I don't know who quoted this. I'm forgetting that only if each one of us as a whole of society approach, where we are working towards solidarity in meeting this challenge, if we can ensure two things. First, that we pledge that we will do all that it takes to keep ourselves safe by simple small measures, and by making sure that we keep others safe in our family and around us. Very important message. But let me take this to Dr. BEENA. Dr. BEENA, two important points here. See, I see that family members of who get infected are affected by this. Healthcare workers also, who are at higher risk, we know, because of the increased viral load that they'll be exposed to in the healthcare settings, and even the family members of healthcare workers. So what do you think is needed in terms of psychosocial support for these important population groups to cope with it, especially the healthcare workers and their families? Dr. BEENA, if you can hear me?
Yes, I can, Vivek. There is no one, if you look at the different layers who need to cope up with COVID, we just heard Edwin, people who are positive, their families, people who are isolated, people who are waiting for their results, and of course the healthcare workers and their families. Yes, it's so nice to hear people like Dr. Rajni and even Dr. Ram, people who have so selflessly contributed to this fight. And then we hear about the kind of stigma that's meted out to these people as well. So one thing that we have been being from a research background, you do realize that very often you just think in terms of, healthcare workers, yes, being selfless and contributing, but nobody realizes that they also have needs themselves. The kind of challenges that they face from, they are also entitled to fear. They are also entitled to all the concerns about transmission, given the high transmission dynamics. And what does it do to them, their mental health? How do they kind of, maintain this balance between their work life and their family life? It's terrible to hear about, nurses and doctors who leave their young children behind and wondering about the safety of those kids who have to sometimes be quarantined, after their shift and then come back home and yet continue to have this anxiety within them. The kind of relationships that are being compromised because of this selfless fight. And I think the time has come to also consider, yes, we need to think in terms of counseling for COVID patients and the different layers that I already mentioned, but the need for offering services, one, to assess their mental health, to find out, have they gone through a burnout? What's the kind of support that they need, in terms of counseling, or even, to be able to have a support group from their own peers. Nobody really thinks about these healthcare workers at different levels. Everyone who administers care for COVID, I think they also need help and they need counseling. And I think the time has come when our counseling has to be holistic. Yes.
Thank you, Dr. BEENA. And as you said that, yes, even healthcare workers, and more so, as I see, they are the ones who need most of the support, and their family members and virtually everyone in the community. What I feel is that given the expertise of the panel and the current context, I see a lot of questions in the chat box. So I would want, Valerie, can you go through the questions, and I would want to now open it up to Q&A session and pose it to the relevant panelists. So Valerie, can you hear me?
Yes, I can hear you. So there were a lot of questions that I've compiled to the chat box. But I was thinking, Dr. Vivek, we have a few raised hands since a while. Could we take those questions also, perhaps?
For sure.
Okay, thank you. So I'm going to unmute Nivedita. If you can hear me, Nivedita. Hi, are you there? Okay, perhaps Nivedita is not there. I'm going to unmute Dr. D.S. Rawat. His hand has also been raised for a bit now. Dr. D.S. Rawat.
Yeah, good evening. I want to congratulate Madam BEENA Thomas that she has suggested a very good thing that, there was a word or like social distancing is concerned. It is very derogatory type of a suggestion. It should be the physical distancing, it should be, it would have been liked by a lot of people and all, And second second term has been advised by, Prime Minister, that is around, 2 gaj zameen, 2 gaj distance rakhiye. And that is also, in India, if you see, our shops are very small. If you go to the groceries or, vegetable market, 2 gaj means it is more than 6 feet, And 2 gaj is a synonyms of the burying the person or something, full body, whenever we want to bury, So though it is a very catchy word, but such type of the word is very against social type of the, word.
Dr. Rawat, so sorry to interrupt you. Could you please move to a question, because today we have a lot of questions. So
And second, from Dr. Ravikant, that pulse oximeter, that use of the pulse oximeter, I don't think that is more useful. This device is very, I say it is a costly today in this present scenario, but it is a use, it's a simple pulse oximeter is, I don't think that thermal scanning is okay, but I am not in favor of that, though it may be required, in the hospital or some quarantine areas and all. That is it. Thank you very much for giving me time.
Okay, thank you, Dr. Rawat. Does the faculty have any comments on this?
Valerie?
Yeah.
Yeah, I mean, the first 2 points are very relevant, and those are comments that whatever communication strategies we have should be socially contextualized, and that's very well taken. The point regarding the pulse oximeter, and especially where we were discussing about when should people who are in home isolation feel the trigger and the need to go to the hospital, and that's where Dr. Ramnath said that people can decompensate quickly, and the breathlessness may not be very easily identifiable, and we should also be looking at. So I'm just posing this question to Dr. Ramnath, that yes, for Indian context, I heard Edwin say that he bought a pulse oximeter which is like $4,500. So what's the value of this, and where can it be used? Should it be used? What's the alternative? I'll leave this question to Dr. Ramnath, if you can hear me.
So, I mean, I don't know that there's great evidence to bear out, having your own pulse oximeter and, spending the money on it. Certainly, it would be a benefit to detect low oxygen level before you may detect it clinically. So one could see that there could be a benefit. And for NGOs like what Dr. Ravikant is doing, where they're maybe visiting many households to screen many individuals, there it makes a lot of sense, right? Because you're using a single pulse oximeter, provided it's being disinfected appropriately. You can screen many, many individuals at the household level on a daily basis and identify those who may have low oxygen, who may require early intervention. So from a public health standpoint, to provide support to families and individuals who have COVID, who may have ongoing symptoms, be early in their infection, from that perspective, I think it has the potential to be beneficial. I would say there's not necessarily any data on it, whether it's more beneficial than a very careful symptom screen. But I could imagine that it would be beneficial to have that and to screen many households on a given day who have individuals with COVID.
Yeah.
Right.
So basically,
Thank you.
Thank you. Thank you.
Thank you.
In Mumbai, it is used, and lots of asymptomatic with very low SpO2 is roaming around. So probably if we screen them, we can reduce the critical severity. We can reduce, and that's why BMC is using this.
Right.
Fair enough. And please document this, Dr. Ravi. And if you're supporting BMC, make sure that we get some evidence out of this. We can document this. Can we take a few more questions, Valerie?
Right. So I'm going to move to Anindita Mazumdar. I'm going to unmute you, Anindita. Are you there? Okay. Moving on, I'm going to go to Anto Paul. Anto, I'm trying to unmute you. If you could just accept my request to unmute you. Okay, while we figure out the technical glitch with Anto, I'm going to take some questions from the chat box. So we had one question, we had 2-3 questions basically on dietary recommendations for comorbid patients, and if there are any other specific dietary recommendations for people who are COVID positive. So I believe that Edwin had covered that briefly, but if any other faculty members could also comment on that, please.
I'll pose this question to Dr. Ramanath, please. This is a very important point, and I also heard Edwin's tell about some of the naturotherapy things like Ayurveda, basically immunity boosters. He mentioned about turmeric and honey, I believe, whatever he mentioned. But Dr. Ramanath, so this is a very important point. So you mentioned about the risk of dehydration and some of the things that should be done, but other nutritional advice, especially for people with comorbid conditions. Over to you, please.
So, I mean, I don't think there's any very special nutritional advice other than you shouldn't restrict your diet. Because restriction of the diet, which often happens, people have a misconception that, oh, you know, I should only eat very easy to tolerate foods or something like that. You know, especially not eating protein, I think can be a problem if you're not having enough protein intake, not eating good diversity of foods, and not eating broad, you know, the normal broad diet that provides broader nutritional basis that people would eat, which is unique in every region of India, obviously. But I think the key point is I wouldn't necessarily restrict the diet. There's no point in restricting the diet. And the dehydration point, I think, needs to be reemphasized, because I think people, water oftentimes is not sufficient rehydration. You also need things that contain salt. So, you know, in the South Indian diet, rasam, for example, it tends to have quite a bit of salt. Soups that have salt content, that helps to keep you from getting dehydrated, because people can get very dehydrated with fever. Those are the two very basic points. The biggest problem I see is restriction of the diet.
Right.
Very valid, very valid. And somebody rightly pointed out, so even Ministry of Ayush, for example, what Edwin mentioned about turmeric has given some advice, so you can follow that. And Ayush guidelines are available for basically immunity boosters that India has known traditionally for ages. So you can follow that. Any other question that you see, Valerie?
Right. So there are two last very pertinent questions that I would like to take from the chat box. One of the questions is directed towards Dr. Ravikant, is that to use the NGO staff, I mean to involve the NGO staff, is there any training module to coach them and get going with other health workers? What is the model that you follow?
So there are various modules now available on the Ministry of Health website. Even other ministries also, Women and Child Welfare, they all have various guidelines. So for the NGO worker, all the guidelines who are for the grassroots level worker, like for ASA, Anganwadi or ANM, on the same module, the NGO worker can be trained because there is, as such, there is no separate guideline for NGO worker. Many NGO have themselves, like we also have developed our own guideline or conducted a special training for our worker, because many a time these guidelines are in English and our field volunteers are Marathi or Hindi speaking, so we have to translate that. So it's quite easily available, and now to lots of material. You just Google it, you will find it online.
Thank you, Dr. Ravikant. And what I would like to add here for all the CSO partners and everybody here, people in the civil society who want to get involved in the front lines, as Dr. Ravikant said, please visit the website mohfw.gov.in. It has all the basic modules. Plus, you can Google I got, which is the a training portal website for Government of India, where they have archived virtually all trainings for frontline functionaries, as you call it, not just the health workers, even from civil society who want to get trained on different aspects. You can also visit some of our previous lectures at this COVID Academy with Sphere India and NDMA. There are many topics that you will see that that you will find here. And plus, there's a whole repository also on the links that are now available on the COVID Academy platform. You had another question, Valerie, in mind,
Yes.
which you said is common, and please.
Not common. So this is the last question that I'd like to take. It's a very specific question from one of our regular participants, Kanchan Thapa. She said that I recently delivered, I helped with the delivery of a woman with a malnourished condition, and she's still in the post-natal PNC ward of the hospital. She's positive COVID-19. What should be the intervention for her?
So I'll add then probably other. So the two thing is very important, that as such, the first thing is breastfeeding. She should continue the breastfeeding of the child, and the malnutrition treatment, like obviously there is no special guideline for the malnourished mother with COVID. Yes, so she can continue with the routine diet, and probably extra take home ration can be given. Vitamin A doses can also be given now, because now she is delivered, so vitamin A doses can be given to her. Rest other panelists can add.
I'll ask Dr. Ramanath, please, if you want to add something.
This is a very difficult question because, part of the question is she symptomatic at the time that she was tested positive? If she has symptoms, it becomes complicated as to what happens with the child and how the child is managed. Because obviously after she delivers, the child could be at risk of getting COVID, at least for a very brief period. And it's really, after the time that someone develops symptoms, it's really about a 10-day period that they're actually infectious. It's not necessarily that much beyond that. So generally, the guidelines we use in the US are 10 days after the start of symptoms and then 3 days after resolution of fever. If you meet both of those criteria, generally at that point, you're deemed to be non-infectious. For many women who may be delivering and test positive, some of them, the positive test may actually represent old infection if they had symptoms more than 10, 14 days ago. But if they have active infection, then the key issue from the hospital perspective, if the woman is in a hospital, is appropriate management of the child until the woman is non-infectious. And that's a very difficult and challenging issue. I would emphasize what Dr. Ravikant said. Breastfeeding from the mother to the child after that point is very beneficial, because the immunity that the mother may have from having had COVID will probably be provided to the child, so the child may be less likely to subsequently get COVID. This is true of all infections, and that's one of the central benefits of breastfeeding.
One more point, that mother should use the mask, not the baby. We don't recommend mask for baby below 2 years. So, but mother during breastfeeding, she should use the mask.
Absolutely. And I would just want to re-emphasize, in line with the WHO guidelines, that the baby needs to be roomed in with all the evidence that we have of the benefits vis-a-vis the risk of a newborn being with the mother, roomed in with the mother, being breastfed. But somebody needs to support the mother in making sure that she manages all hygiene, wears mask, washes hand properly, and continues to breastfeed. But the question was also regarding mother's own nutrition, and that's where she needs support. So, with this, although in paucity of time, we may not be able to take any questions today, but we will make sure if we see questions that are worthy of answering, we'll make sure that we have another session. But for now, I would want each panelist to, in one sentence, what's your, and especially if you want to highlight a success story, and what's your message, especially for India at this stage, where we see that we are seeing this lockdown being gradually released, and we are seeing the increasing number of cases. So what's any success story that you want to share, and your final message, please? So I would want Edwin, I heard that your message for others who test positive. So you want to just highlight one sentence. What's your message for everyone at this stage? I'm not sure if Edwin can unmute himself, so I'll go to Dr. BEENA. Dr. BEENA, what's your message for everyone at this stage, especially for the people in India?
Yes, the message I would say is one, be human. I think the time has come to just stop talking and this verbal diarrhea that we hear all the time, people, being told what to do. I think it's time to listen to voices and have whatever you think of doing, it has to be what they want, not what you want them to do. I think, and the main thing is just be human. Physical distancing, yes, but please, not social distancing. I think it's COVID. One thing is it's equalize people, but I think even emotionally we need to be equalized.
Thank you. That's a very important message. Dr. Ramnath, do you have any message based on your experience, any successes for people in India who are seeing these increased number of cases, and at this stage for the epidemic here in India, you have your final message?
So I think it's very easy to become complacent. That COVID becomes old news and we want to move on with life. And I think it's very important for economies to get restarted, for people to get back to work. But taking the basic precautions and making them universal, such as wearing masks, for example, when people go out, and doing it in a manner that doesn't stigmatize people so that everybody is doing it, I think is very critical. One, to protect especially those who are most vulnerable, but also to protect everybody from the social consequences of stigmatizing those certain groups of people for whatever reason.
Very valid point, and I'll make sure that when I'm summing up, I highlight some of the issues here. Dr. Ravikant, any final message to the CSOs? What should they be doing at this stage of the epidemic response in India?
Very simple. This universal masking, focus on that. That is very important. And the second is this stigmatization of the COVID positive person or family should be stopped.
Perfect. Thanks a lot. So, we heard of panelists with their final messages and the deliberations we had throughout the session. Let me try to summarize and see if I can do justice to this. That it's all about perceptions, and as Dr. BEENA said, that initially when the pandemic started, the fear of the unknown was very high, although we had very few cases. If you remember, it was in hundreds when India went for lockdown on 25th of March. Sorry, yes, 22nd and 25th of March. But now if you see, we have crossed 2 few lakh cases. And now, in fact, the number of cases and possibility that we may be near somebody who's infected by it, affected by it, higher, but still people might become complacent, which is not true. We should not loosen our guard. And two things again, as somebody had said, that please make sure that we will take two pledges today. We will keep ourselves safe, and we will make sure that we do everything to keep others safe. And also with this safety, to make sure that we show solidarity with people, and we work towards this response as one society. And we need this whole of society response more than at any point in the epidemic response. And I would also like to highlight the fact that given the conditions in which our friend Edwin today, who shared his experience, not everybody, very rightly said, would be privileged to have those kind of home environment where you have a room to yourself to self-isolate. So there may be a lot of people who are affected today in India who may be living in slums where space is a luxury. So there we need to have context-specific issues that need to be addressed and strategies. And also somebody has very rightly said that our messaging, I think it was Dr. Rawat who pointed out to us that our messaging, social messaging, should be also culturally appropriate when we are doing the risk communication. So with this, I would request everyone to make sure, as civil society organizations and others who have joined, that we keep informing and educating people around us that the risk has not gone down, and we cannot become complacent. Otherwise, all the advantage that we had because of the lockdown, and now that we are opening up because of the economic imperative, our health workers will be overwhelmed. And we all already know how overwhelmed they can be from what we are hearing in Mumbai. And we need to make sure that the psychosocial support, which Dr. BEENA very rightly highlighted, that each one of us can become a psychosocial counselor, very simple. And we need to take care of ourselves, those who are fighting on the front lines, their family members, those who get affected by it. So with this, we'll call this session a close, and wish you all the best. Stay safe, and thanks to all the panelists for taking time out to join this session today.
Thank you, Dr. Vivek. Thank you, all of the panelists. Thank you, Dr. Ramnath, Dr. BEENA, Dr. Ravikant, and Edwin for being here. My last few announcements for our participants are that to receive your certificate of participation for this panel discussion, please visit the following link after 24 hours, which is www.sphereindiacovid19academy.org. Next to the name of the panel discussion, you will see the link for the certificate. Click on that, enter your registered email ID, and you will be able to download your certificate. You can also find out information about our upcoming course on the same website. If you have any questions, queries, suggestions, feedback, or you want to communicate with us regarding anything, please feel free to write to us at COVID-19 Academy at sphereindia.org.in. Thank you very much, Glenda, for helping us again today. And
sorry, I need to just come in here. Can we just, Valerie, you haven't introduced yourself, and we just want to thank you for all your efforts as well.
Hi, I'm Valerie. I am with Sphere India, and I am the manager for knowledge and capacity sharing, and I've been handling the COVID-19 Academy since its inception. Yes, that's about me.
Thank you.
Thank you. Thank you for that, Dr. BEENA. Thanks, everyone. Have a safe evening. Thank you. Thanks, Glenda. Take care, everybody. Bye-bye.
Thank you so much.
Thank you, everyone.